Good morning, everyone. We are joined today by Dr. Theresa Tam and Dr. Howard Njoo. We'll begin with an opening statement, followed by questions from our Zoom participants. Doctors?
Hello, everyone. Bonjour à toutes et à tous. Last week's modeling update showed that while a resurgence in cases could still occur with the easing of public health measures, the predicted trajectory for hospital admissions is expected to be lower for COVID-19. In the week since the modeling update, epidemiological indicators of COVID-19 disease activity have continued to improve across most jurisdictions. Nationally, weekly case counts are down by 26%, and the number of people with COVID-19 in hospitals and ICUs have declined by over 20% compared to last week. Nevertheless, as the SARS-CoV-2 virus is still circulating widely, some jurisdictions are reporting weekly increases in case counts, and others could see additional bumps in the weeks ahead. As such, Canada continues to closely monitor a range of indicators, including using wastewater surveillance for early detection and monitoring the amount of virus in community samples. At the same time, there is continued high volume of PCR testing being performed and ongoing genetic sequencing of circulating virus variants. While the BA.1 sublineage of the Omicron variant is still dominant in most provinces and territories, we are picking up an increasing presence of the BA.2 sublineage, which currently accounts for about 10% of our domestic samples. Based on preliminary case surveillance data from Denmark, where BA.2 is now dominant, this sublineage does not appear to be associated with more severe illness. Similarly, data from England, where BA.2 is steadily increasing, shows no indications of a difference in immune escape or vaccine effectiveness compared to Omicron. That would be Omicron BA.1. However, both countries report that the BA.2 sublineage appears to be even more transmissible than the BA.1 sublineage. As with other variants of concern, the risk of infection and severe outcomes are expected to be highest among the unvaccinated. Knowing that the vaccines are still expected to provide substantial protection against serious illness really underscores the message that people need to get their COVID-19 vaccines up to date. In particular, getting a booster dose if you're eligible, and especially for those aged 50 years of age or older, is very important. The evidence supporting the value of booster doses continues to get stronger. Recent studies indicate that an mRNA COVID-19 vaccine booster dose enhances the overall immune response, which can provide longer lasting protection and possibly better effectiveness against variants. So if you or a loved one are eligible for a COVID-19 booster dose, I would urge you to get that very important additional shot of protection. Now it's not too late. In fact, the time to do this is right now. As we've said, our best advantage going forward is to maintain a state of readiness. Canada's public health authorities will continue to adapt and share guidance and recommendations to help guide us as and when the situation changes. At the individual level, in addition to keeping COVID-19 vaccinations up to date, readiness can be best achieved by continuing to follow public health advice, which is tailored to local epidemiology and circumstances to help guide your individual and family risk assessment and decisions on the use of personal protective practices, such as masking. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. La mise à jour sur la modélisation de la semaine dernière indiquait que, bien que l'assouplissement des mesures de santé publique puisse entraîner une recrudescence des cas, le nombre d'admissions à l'hôpital devrait être plus faible. Dans la semaine qui a suivi la mise à jour sur la modélisation, les indicateurs épidémiologiques de l'activité de la COVID-19 ont continué à s'améliorer dans la plupart des administrations. À l'échelle nationale, le nombre hebdomadaire de cas a diminué de 26% et le nombre de personnes atteintes de la COVID-19 dans les hôpitaux et les unités de soins intensifs a diminué de plus de 20% par rapport à la semaine dernière. Néanmoins, comme le virus est toujours largement répandu, certaines administrations enregistrent des augmentations hebdomadaires du nombre de cas et d'autres pourraient connaître de nouvelles hausses dans les semaines à venir. Le Canada continue donc de surveiller étroitement une série d'indicateurs, notamment en recourant à la surveillance des eaux usées à des fins de détection précoce et en suivant la concentration des virus dans les échantillons communautaires. Parallèlement, les tests moléculaires et le séquençage génétique des variants du virus en circulation se poursuivent à un niveau élevé. Bien que le sous-variant BA.1 du variant Omicron soit toujours dominant dans la plupart des provinces et territoires, nous observons une présence accrue de sous-variants BA.2 qui représente actuellement environ 10% de nos échantillons nationaux. D'après les données préliminaires relatives à la surveillance des cas au Danemark, où BA.2 est maintenant dominant, celui-ci ne semble pas être associé à une maladie plus grave. De même, les données de l'Angleterre, où la présence de BA.2 est une augmentation constante, ne montrent aucune indication d'une différence dans l'échappement immunitaire ou l'efficacité du vaccin en comparaison avec Omicron. Cependant, les deux pays indiquent que BA.2 semble être encore plus transmissible que BA.1. Comme dans le cas des autres variants préoccupants, on s'attend à ce que le virus d'infection et des conséquences graves soient le plus élevés chez les personnes non vaccinées. Quand on sait que les vaccins sont toujours censés offrir une protection substantielle contre une forme grave de la maladie, on ne peut que souligner la nécessité pour les gens de garder à jour leur vaccin contre la COVID-19. En particulier, il est très important de recevoir une dose de rappel si vous êtes admissible et surtout si vous avez 50 ans ou plus. Les données probantes qui confirment l'utilité des doses de rappel ne cessent de s'accumuler. Des études récentes indiquent qu'une dose de rappel d'un vaccin à ARN messager contre la COVID-19 renforce les réponses immunitaires globales, ce qui peut fournir une protection plus durable et peut-être une meilleure efficacité contre les variants. Donc, si vous ou l'un de vos proches êtes admissible à une dose de rappel d'un vaccin contre la COVID-19, je vous recommande vivement d'obtenir cette très importante dose de protection supplémentaire. Il n'est pas trop tard. En fait, c'est maintenant qu'il faut le faire. Comme nous l'avons dit, notre meilleur atout pour l'avenir est de maintenir un état de préparation. Les responsables de la santé publique du Canada continueront d'adapter et de diffuser des directives et des recommandations pour nous guider au fur et à mesure de l'évolution de la situation. Au niveau individuel, outre le fait de garder à jour vos vaccins contre le COVID-19, le meilleur moyen de rester prêt est de continuer à suivre les conseils de santé publique qui sont adaptés à l'épidémiologie et aux circonstances locales pour vous aider à évaluer vos risques individuels et familiaux et de prendre des décisions concernant l'utilisation de mesures de protection individuelles comme le port de masque. Merci. Thank you. Miigwech.
Thank you. We'll move to questions. Please raise your hand on the Zoom platform if you have a question. We'll begin with Dylan Robertson, Winnipeg Free Press.
Hi there. Thanks for taking our questions today. Dr. Tam, I wanted to ask about Canada Post's mask policy. The agency has been sending home staff for wearing respirators instead of level 2 masks. Canada Post says that respirators can only be worn with a fit test and that it's unfeasible to do a fit test for a large number of staff. The Canadian Centre for Occupational Health and Safety suggests that a fit test is only needed when the device is meant to prevent inhaling aerosols. The agency says that if Canada Post's objective is only about preventing exhaling particles, then a fit test isn't needed. I realize that you don't run the Postal Service, but I'm wondering if you have any sort of advice for these sorts of accommodations.
Yes, I'm not familiar with that particular situation, but I think for the general public, for instance, we are recommending getting the highest quality mask that you can get your hands on, essentially, and that includes respirators. And the key is to make sure that the mask fits well against your face, covers your nose, your mouth, etc. So I think that should be taken into account by employers. We certainly do recommend this range of masks for the general public. And I'm not sort of familiar with the precise policies, but I certainly think a respirator depends. I don't know the circumstances under which Canada Post workers work, but I think that for general public and the settings that a general public can encounter, then you don't need an actual fit testing. This is not for a medical situation like in a hospital or in a long-term care facility even, where you're taking care of sick patients. So for these kind of general circumstances, we have recommended, as you know, this range of face coverings and masks and respirators as individuals see fit. But we do recommend the highest quality mask that you can get.
Thank you. And as a follow-up, I'd like to also get your advice for the public when people are living in provinces where they're dropping masks and vaccine mandates. We know that federal agencies and some private businesses are keeping these in place. I think you mentioned at the end of your remarks in English that masking might be with us for quite a while. I don't know if you want to comment on if it's prudent to drop those sorts of measures, but if you have advice for the public in areas where that is actually being taken off the table quite soon.
Yes, I think masks continue to be, I think, a really good layer of personal protection. And I think that even if it's not required in the jurisdiction that you're in or the community that you're in, you can choose to wear a mask as a personal protective measure. It's a habit that we've developed over the last couple of years. And I think it's good for the prevention of not just COVID-19, but maybe other respiratory viruses as well. So I think that's really important, especially if you have a higher risk of developing serious outcomes from COVID-19. So I think in the days and months ahead, we need to do a better job in equipping individuals with the tools that they need to make those personal based decisions. But I still think that masks remain one of the foundational layers of protection. And it may be the last thing that you want to remove in your personal, armamentarium of tools. And the same thing applies whether you're going to different communities in Canada, but also internationally, where I think travelers should also be equipped with masks so that they can actually wear them depending on the situation that they're in and the community virus activity as well. I think that in the months ahead, in adjusting to a new way of managing and responding to COVID-19, you might sort of think of checking your local COVID virus activities, but like going out checking the weather. You would want to check on the weather to put on a coat. So check on the weather and bring your mask with you if there's virus activity and you're going into an indoor setting with people who are outside of your household, for instance. And that kind of messaging and habit we've developed over time, and that needs to be reinforced. And I think all the public health departments are trying to do some of that at the moment. And I think the members of the public could also give feedback as to what kind of information that they still need, and that will be helpful to all of us.
It's Dr. Njoo. The other point maybe I would add to what Dr. Tam has said is that I think there's a distinction to be made between policy in terms of obligatory use of face masks versus, as Dr. Tam said, a sort of a personal empowered choice, to make in terms of wearing a mask because you're concerned for your own personal protection. It's another layer of protection that's without doubt been shown by the science and so on. And so the other point is that as we move forward, we also want to make sure that we don't stigmatize and make it difficult for individuals who choose to maybe want to wear a mask for lots of reasons. Maybe you're immunocompromised, or for other reasons you would like to protect yourself, or maybe avoid possibly transmitting it to others in your family who might be also at higher risk. So I think it's all about choice as well, but also making sure that people make those personal choices, that we also support them in making the choice to wear a mask. Thank you.
Thank you. Next question goes to Olivier Ferron-Boisé.
Oui, bonjour. Toujours dans le même sujet, Québec a annoncé que les masques allaient tomber dans les écoles, dans les classes, après la semaine de relâche. Est-ce que vous croyez que c'est une bonne décision dans la mesure où on parlait de choix de porter un masque si on se sentait à risque? On sait que les enfants sont peut-être moins à risque d'avoir des maladies graves liées à la COVID.
Merci pour la question. Oui, moi, je pense que c'est pas pour moi pour prononcer sur la politique au Québec, mais je pense que c'est important de faire les distinctions, les différences entre une politique pour le port de masque obligatoire dans certains contextes ici dans les écoles, mais aussi je pense que le Québec considère aussi peut-être qu'est-ce qu'on va faire dans les autres endroits publics. Ça, c'est quelque chose à suivre. Pour moi, c'est aussi un enjeu pour donner un choix, parce que c'est toujours important pour les gens qui peut-être pour plusieurs raisons peut-être sont plus à l'aise pour continuer à porter un masque. Comme on a aussi dit en anglais, que peut-être une personne, peut-être pour les autres raisons, peut-être quelqu'un immunodéprimé. Pour quelques personnes, c'est toujours important, peut-être pour une autre couche de protection, d'avoir, comme on dit, le choix, et aussi être à l'aise, aussi pas peut-être pas se sentir à risque d'être stigmatisé ou être aussi discriminé pour le choix de porter un masque. Je suis sûr que pour les enfants, la plupart des enfants, si on attrape le COVID-19, peut-être c'est pas vraiment une maladie grave, mais on ne sait jamais. Peut-être pour eux, et peut-être il y a des autres membres de la famille, peut-être les grands-parents, les parents aussi, peut-être qui font partie des populations plus vulnérables. Donc, je pense qu'on fait une compte, c'est toujours une décision pour le gouvernement de Québec, pour une politique dans les écoles, aussi peut-être plus tard pour les autres endroits publics. Mais pour moi, personnellement, c'est encore une autre couche de protection. Et il faut aussi supporter les personnes qui choisissent peut-être de continuer à porter les masques dans certains contextes. Merci.
Merci. Puis en suivi, Dr. Njoo, j'aimerais peut-être juste avoir un peu peut-être une mise à jour sur sur le concept d'immunité collective. Est-ce que c'est quelque chose qui est encore, si on peut dire, atteignable? On estime au Québec, je ne sais pas dans les autres provinces, mais qu'il y a 3 millions de Québécois qui auraient contracté le virus dans les dernières semaines. Est-ce que ça serait suffisant pour atteindre ce concept-là, ou est-ce que c'est une possibilité, disons, que cette immunité-là soit fournie grâce au nombre important d'infections qu'il y a eu dans les dernières semaines?
Non, merci pour la question. Ce que je peux vous dire, que tout le monde a vu pendant les deux dernières années que le virus, la COVID-19, c'est vraiment, comme on dit, un adversaire formidable avec toujours beaucoup de surprises. Moi, je pense si on parle le concept de l'immunité collective, c'est difficile à atteindre parce que même maintenant, avec peut-être le variant Omicron et aussi avec les autres variants, on voit que si on a été infecté, c'est sûr, on a une certaine période d'immunité, de protection contre ce variant, mais est-ce que c'est une immunité durable pendant combien de mois? On ne sait pas. On sait même avec les vaccins, ça donne une bonne protection contre peut-être l'infection ou au moins les maladies graves pour un bout de temps, mais c'est pas que pour toujours. Donc, je pense que même avec peut-être une bonne proportion, comme vous avez dit au Québec, de la population qui a été peut-être infectée avec le variant Omicron, la protection peut-être dure pour une certaine période de temps, mais c'est pas nécessairement suffisant pour vraiment avoir, comme il dit, une immunité collective pour toujours contre la COVID-19. C'est toujours quelque chose, il faut suivre les données probantes d'épidémiologie, aussi l'efficacité des vaccins pour peut-être continuer à regarder c'est quoi la protection à l'échelle de la population et ajuster nos mesures aussi peut-être c'est quoi peut-être même le calendrier des vaccins. On parle maintenant d'une dose de rappel, mais on ne sait pas pour le futur c'est quoi, qu'est-ce qu'on va faire pour peut-être des doses additionnelles. Donc, c'est quelque chose à suivre toujours avec les sciences et toujours être prêt, d'être flexible, à ajuster ce qu'il faut faire quand le moment arrive avec l'épidémiologie. Merci.
Thank you. We'll move to Jamie Morocker with Global News.
Hey, everyone. I'm just going to follow back to the mask question and ask you to clarify a little bit more. I know that you guys are not in the business of making policy, but you are in the business of making recommendations for health. So can you be very, very clear? So you're saying you want or you think people should still wear them. So are you recommending that mandates not be lifted right now? Would that be can you just be very clear about what it is that is the health recommendation when it comes to masks?
Health recommendations, masks provide a good layer of protection. It's a fundamental layer of protection for people. And you could ask people to wear a mask in different ways. So I think many of the provincial territorial medical officers of health are saying that what they're switching to is from requirements to recommendations. That switch isn't always easy to do. Certainly, most of this is not within the federal jurisdiction, but I think our recommendation is that wear masks to reduce your risk for COVID-19 and get the highest quality, well-fitted masks and wear them properly as part of your protection, whether your jurisdiction requires it or not, or whether a certain setting requires it or not. It is something that you can do to protect yourself and others. So right now, the key to recognize for most people in this country is that the virus is still very much alive, is active in your communities. So even if there's no requirements, depending on the virus activity level, people should choose to wear masks. It should be probably one of the most foundational layers that you can use. But I think the switch from requirement to recommendations is simply a very difficult one. And it is difficult for businesses and other organizations to transition as well, because it's actually quite simpler almost if public health or other policies are in place that just makes the messaging and the requirements simpler. But we've got to begin to move beyond requirements and adapt our personal habits as well to prevent virus infections.
And just to follow up, if you could answer in English on whether you feel like masking in schools could be lifted at the same time as the general public. Is that a good decision at this point based on where we are with hospitalizations and case counts and all that sort of thing?
Yeah, I still think that masks are a good layer of protection, and it's something that people got used to using, and that kids or parents should feel that perfectly comfortable and be supported in their kids wearing masks if they choose to. Right now, I think what Quebec is saying is that they've looked at the vaccination rates, they've looked at some of the antibody studies in their populations for school age. I believe it's more the 12 plus. But they have data that they're using to base their policy decisions on. We know that the Omicron wave has caused quite a lot of infections. And if you had 2 doses of vaccine and you got infected, that's probably quite a good or reasonable level of protection against Omicron. We still have to watch out for the next variant. And I think people, even if they remove the policy, should be alerted to the fact that if another variant occurs, that is vaccine or immune escape, be prepared to have your mask ready for that moment in time when we may have to re-escalate some of these measures. And what no one wants to do is to see schools being shut down again. I think that is a collective goal for public health systems across the country. And if masks has to be reinstituted at some point in time, then that is, I think, a layer of protection that people can use. I guess the message is that even if the policy is removed, based on the data on the ground, I think the members of the public should remember that they should be ready to re-engage and get those layers of protection on, we don't know when. I think monitoring and surveillance is very important. We're certainly planning towards the fall because that's where respiratory viruses can often re-escalate. But anytime between now and the fall, we still could be surprised by this virus and be prepared to put some of these policies back that are not as restrictive, if you like. I think people should do everything they can to keep schools open. And by the way, that also includes, I think, we hope some improvements in ventilation systems and other measures at schools as well.
Thank you. Next question, Laura Osman.
Hi, doctors. Thanks so much for taking our questions today. Dr. Tam, I wanted to just pick up exactly where you left off there. I remember last fall, before Omicron, we were talking about, the possibility in the spring we could be talking about the pandemic being over. That was before Omicron hit us all. Now we're seeing vaccine mandates being called down, masks mandates being called down, the implication being that they're not going to come back. So I'm wondering if you can, help people adjust their expectations. Could these big government public health measures see a return in the fall, or are we moving into a future without those?
Well, I think what I was saying is that, we're going to get a bumpy ride over the winter months, and we hope to be in a better place in the spring. A pandemic is a global phenomenon. So even if the virus activity comes down in Canada, that's not to say that the pandemic has disappeared. More and more we learn about this virus, the more we understand that it's not going to disappear. It's not just in humans, it's in certain animal species as well. So that makes it really difficult to really you just can't get rid of it. So what will happen to the virus and its interactions with humans, there's different scenarios, but nonetheless, we must not forget that this virus will still be with us. And hence, a need to adapt how we manage the resurgences, if you like, going forwards. I think what we're hoping collectively across the country is that the sort of more crisis phase is behind us, but this phase we're calling the transition phase is one where the response measures have to be adapted based on the lessons that we've learned and the fact that we have more tools. The recovery measures have to occur because society has undertaken a lot of negative impacts as well as our health systems, and be ready. So it's the readiness aspect that we all have to understand is, get ready for a potential worse variant than what we've seen, I think is actually really important to do. It may or may not happen, but with so many changes in the virus being undertaken around the world, and not the whole world has had good enough vaccination uptake, the next period of time is actually uncertain. Nobody likes to hear that word either. But uncertain doesn't mean we don't have the ability to be ready and be able to manage the resurgences with less societal impact. And as I said, we need to be ready for the fall in case we need to up our game again. I don't know exactly what policies may need to be reinstituted, but I know there'll be a big effort to reduce the heavier sort of restrictive measures, but maybe reinstitute less heavy measures like masks requirements in certain settings. And of course, we are trying to look at the vaccination strategy going forwards as well.
Yeah, when you talk about public health measures, your advice isn't only about, what would be most effective from a health perspective. There's also, what people will accept and a political element to that to some extent. Some of these measures are very politically fraught right now, like vaccine mandates. Do you see a world where they might return?
Well, I don't know. I think it's what at different levels of the system people think it would be the most effective in protecting their populations and protecting each other. But I think that the collective objective is the following, which is to be able to reduce the severe outcomes, the hospitalizations, the deaths that have unfortunately occurred. We want to prevent those. We want to protect those at the highest risk of severe outcomes, but also those at a higher risk of the severe impact of the pandemic and the measures, and being able to balance that with minimizing impacts on society. And with that in mind, they are difficult balances. I think we're at a better situation now than we were before and be able to achieve that. And with that comes, I think, less perhaps a need for some of these more restrictive measures. But, I don't think we should be able to discount them entirely. But as I said, the collective objective is to move from requirements to recommendations. But if a variant occurs and people are impacted severely, then I'm sure all of these policies will again be re-examined.
Thank you. Next question, Vic Adopia, CBC.
Thanks, doctors, for taking my question. I would just want to change gears a bit. You know that AstraZeneca's new pre-exposure COVID therapy has been approved by Health Canada. How do you see that being used in this pandemic or in this stage of the pandemic?
Now, I'm sure the last comment is correct. I know that what was announced was a advance purchase agreement to obtain some doses when the regulatory authority, that's Health Canada, authorizes its use. So that's just something that should be verified, and I can't comment on the regulatory timelines. But what this additional antibody preventive measure is designed to do is mostly for people who don't develop a good immune response to either the vaccines or even infection with the virus. They can't mount a good antibody response to those under those circumstances. It is another option to provide the antibody as what we call passive prevention. And I think that the idea is that it is could be helpful to people who are immunocompromised or with underlying risk factors, particularly if you are not able to be vaccinated. But we expect also guidance to be developed on the use of this new tool as the regulatory authorizations progress. I don't know if Dr. Njoo, you have anything further to add?
Not much more to add, Dr. Tam, other than to say that it is a potentially new tool that could also be used in a certain context, as you indicated. And I would put it that, certainly when we talk about monoclonal antibodies, that there might be a bit of confusion. The ones that are currently in use now are more, quote, on the treatment side. So for those individuals who actually do get the infection and, and end up maybe with a more serious illness, certainly they've been used to good effect in sort of the hospital and healthcare setting. This new product, if it does get approved by Health Canada, I think it's more, we say, on the prophylactic side in terms of trying to prevent individuals who, for whatever reason, may not benefit from vaccination, so on, so that they are protected against infection and then obviously more serious consequences. Thanks.
And yeah, my apologies for that assumption about its approval. The other question is, should this or would this be available to someone who has turned down being vaccinated if they're, logically at higher risk of getting infected with COVID-19 and having more serious outcomes?
Yeah, as I said, there would be guidance at some point provided, but just as with some of the treatment measures, it should be based on data on who's at the highest risk. And so I think, that's the bottom line. And it doesn't necessarily matter whether someone has been vaccinated or not. If they can't mount a response or for whatever reason is not vaccinated, then it is an option for people. But, its use is a lot more complicated. Even if it's longer lasting, it's also not going to be, long term. One wouldn't suspect, as we've seen these kind of preventive antibodies being used in the past. They're only for a certain period of time as well. And vaccines still remain the most effective population-based measure for preventing this virus impact.
I see no further show of hands on the Zoom, so thank you. That concludes today's press conference. Thank you very much, doctors.
Thank you very much. Bye.